you imagine what's going on here? If we're over the macula, we should be in the macula now. We don't see anything. So this, now, how do I still know? So when you have dropout of the nerve fiber layer in the ganglion cells, what do you suspect is going to be the ultimate reason for the optic atrophy here? What do you think? Yep, loss of nerve fiber layer, loss of ganglion cells. Glaucoma, yeah, I would say glaucoma. But we need to go for something different. How do I know that this isn't a case of chronic retinal ischemia? How do I know that this is not just status post big retinal infarct? Okay? Now, what is the blood supply of the retina? So if you take the arterial circulation, the blood supply of the neurosensory retina, of course the outer retinal layers are supplied from the choriocapillaris. The inner retinal layers go down to about here inside the internuclear layer. If this were an arterial occlusion, I would not have an intact inner plexiform layer, and I would have lost a portion of the internuclear layer. So this is not an arterial occlusion. Is that okay? In the American examinations, the histologic distinction between glaucoma and retinal ischemia becomes a very big question that is asked very, very frequently. Okay? I don't know if I'm giving Professor Pe'er any ideas for you, but it's a very, very commonly asked question. So we have here a very, very interesting situation. We have here a retina that is speaking to us and telling us that we have most likely glaucoma. So you come to the optic nerve in the back, which we already know is atrophic, and we're not finished with this by any means. Let me bring this down, magnification. And when I am teaching in the United States, so I make a joke of this in English. I say in English, this is a very sacred optic nerve because it's very holy, you know. I can't do that in Hebrew, it doesn't make any sense. But here, you can see that there are big spaces. I will tell you that these spaces are filled with an acid mucopolysaccharide. This is also asked very frequently on examinations. It's never been seen clinically. This is an entity called Schnabel's cavernous degeneration of the optic nerve. Usually indicates excessively high intraocular pressure. We're okay with this so far? Yes? Okay. Everybody's okay. High intraocular pressure. Now, the pathogenesis is a condition, a bit controversial. Some people think, and I have to remind myself to slow down. Someone asked me to slow down. I have to think, some people think that the pressure is so high that it forces vitreous back into the optic nerve. This may be a shtuyot. Other people will say this is an infarct, because sometimes an infarct, so the central nervous system, you get acid mucopolysaccharide. Never mind, the pressure in this eye is very high. Now, before we go and look at the angle in this case, and you may, oh, by the way, you can see the optic nerve is atrophic. I want to point out something to you that is of interest to our friends who are internists, and that is of no consequence to ophthalmologists at all. But we'll talk to them about this because internists are, in general, very nice people. Most of them. I want to point this out to you. Let's take this. Here I have an arteriole, and it looks very much like a normal iris vessel. It is abnormal because it has a very, very thick sheath. Right? It should be very, very thin. Let me bring this down to you, and I will show you another arteriole with a very, very thick sheath. Another one right out over here. Let's think about this for just a minute. First of all, let's tell you something about the patient's age. We will call this arteriolosclerosis. And now let's go through something that the internists really worry a lot about. If you only have a vessel and it's one endothelial cell layer thick, then oxygenated blood will appear red. So what color clinically is collagen with an ophthalmoscope? We talked about it. White. If you mix a little bit of white with red, you desaturate the red and it looks like a copper wire. If you put a lot of collagen, a lot of arteriolosclerosis in the area, it appears white, it looks like a silver wire. So when your colleagues in internal medicine speak of a patient with hypertension, they speak about copper wiring and silver wiring, and we don't care at all about this, at least you know what they're talking about. They're talking about the relative degree of arteriolosclerosis. By the way, this happens in the choroid.